did my journal review on chronic traumatic encephalopathy, or CTE, in professional sports, retrospective and prospective views. So the discussion of this PowerPoint is going to explain the similarities and differences of CTE and a TBI, or traumatic brain injury. CTE was discovered by neuropathologist Dr. Bennett Omalu in 2005 in the case of the suicide of ex-Pittsburgh Steeler Mike Webster. This pathology is caused by concussive or subconcussive impacts to the head and brain. This over time leads to development of mood, cognitive, personality changes. A lot of cases, the people experiencing this simply went mad. And what's interesting about CTE is, to be officially diagnosed, it relies on the post-mortem detection of a hyperphosphorylated tau protein, which is essentially known as a killer protein that's released into the brain upon single or multiple impacts. This protein hardens almost like a wet cement. Think of that being poured down the kitchen pipes, what could happen. These proteins just choke the brain and stunt all seamless flow of cerebrospinal fluid, the input and output of sensory and motor messages. I mean, you name it. CTE is most commonly found in athletes involved in contact sports, mainly football, hockey, boxing, mixed martial arts, soccer even sometimes, rugby. So a quick recap here. You may ask yourself, well, isn't CTE just a fancy name for a traumatic brain injury? Isn't that the same thing? You could argue yes and no on both accounts, because essentially CTE, yes, technically is a traumatic brain injury. However, a traumatic brain injury is typically one episode, one event, one time. There's an injury to the brain, and the victim or patient is inherently changed from that injury. The results of that injury you can see immediately. At anything from a gait function, neurological function, like the person is completely different after that one episode, that one injury. CTE originally was termed as dementia pugilistica, which was founded in the 1920s from studies done on boxers who were experiencing Alzheimer's, Parkinson's symptoms, tremors. They called it a punch-drunk syndrome, which quite literally meant taking too many punches to the head, much like the situation with Muhammad Ali, how that turned out. I thought these pictures were pretty interesting here, just to show what CTE can actually do to the brain. This picture here on the left, this is a normal brain. This is an advancement of CTE. You can clearly see there's a big difference here. And then these pictures on the right, this one here on the left is a section of a normal brain with no tau protein deposit. This picture on the far right shows a brain from a 73-year-old world champion boxer. This is a severe deposit of this tau protein. So this here was normal brain, 65 years old. This is a 73-year-old champion boxer. So I'm sure you can appreciate the differences here. Moving forward, the behavioral and cognitive changes could be an early sign of this pathology. Unfortunately, again, it relies on that post-mortem detection, this autopsy, to determine the deposits of this tau protein. And as of 2013, 110 athletes had a post-mortem detection of CTE. Out of these 110 athletes, 57 of them were American professional football players, 48 were amateur and professional boxers, 4 professional wrestlers, and 1 soccer player. Another thing I found really interesting about this pathology is that the disease itself could take 8 to 10 years after cessation of repetitive head trauma to actually begin showing symptoms or taking shape, taking form. And these symptoms, just to name a few: cognitive impairment, mood instability, dementia, impaired speech, gait abnormalities, suicidal thoughts. Some cases, it was said that the victim was hearing voices in their head. I mean, you can appreciate all of the things that can be affected. Another interesting stat I saw was that a survey showed 6.1% of NFL retirees aged 50 and above reported presence of dementia, Alzheimer's, and other memory-related diseases when compared with 1.9% of the general population. That's pretty huge gap right there. That pretty much shows that good chances you play football or you are involved in a contact sport. Over time, if you get hit enough, there is going to be some sort of repercussions for that. It could be dementia, Alzheimer's, even worst case CTE. So I thought this was a good article, considering it looked at what constitutes CTE now and what it originally was termed as in the 20s when it was being studied on boxers. Both share very similar qualities in the symptoms, but what makes CTE unique is, again, can't say enough, is the deposit of this killer tau protein that can only be seen after death through an autopsy, where, again, traumatic brain injuries typically, after that single event, that single episode, you can see right away the symptoms and the what actually happens to the individual. Where CTE, a brain scan can show a normal, healthy, functioning brain, but over time it starts to slowly degenerate. So it begs the question of there needs to be more research that can show maybe there's another way to detect this without having to wait till after the person has died. And that's where I believe some of these early signs, these early behavioral and cognitive changes could be a sign that it could be, this is the direction it could be heading. So I thought this was a good article, and I thought it provided some interesting views on how this pathology used to be explained and termed and how it is now.